Good afternoon. So on vaccination, yesterday was our second biggest day ever in the State Commission services with 35,464 vaccines administered. There were an additional 47,000 bookings made yesterday. 25,000 AstraZeneca bookings are still available over the next 7 days, so please get in now and take those up. We've got community-led and culturally appropriate vaccination pop-ups being stood up across Melbourne. This weekend there'll be vaccinations at the Hindu temple, the BAPS Shri Swaminarayan Mandir temple in Mill Park. That's a partnership between the Department of Health and the temple. Translators and medical staff from the community will be on site over 4 days to provide support in Hindi and Gujarati languages. These programs are proving to be incredibly successful with several multicultural communities. We ran one last weekend in Thornbury with the Greek community at their local Orthodox Church. We've had similar vaccination sites for the Jewish community and the Samoan community, and it builds on great work emerging in the western suburbs, especially led by Dr. Mukesh Haikawal and others. In terms of our current cases and the geography, 96 are in the northern suburbs. That includes 54 in Hume, really the biggest LGA involved at the moment, and 18 in Moreland. 55 in the western suburbs, including 17 in Wyndham, 14 in the southeast suburbs, 11 in the inner south, including Stonnington, 6 in the city of Melbourne, 3 in the eastern suburbs, 1 on the Mornington Peninsula, and 4 in Shepparton. With regard to current outbreaks, the Acquire call centre, there are now 25 cases. The source of acquisition is still under investigation. There are 700 close contacts identified. The Box Hill construction site, there are more than 58 cases associated with this outbreak, up from 20 yesterday. All sites are closed. 158 Tier 1 primary close contacts have been contacted. The Japara Bayview Aged Care in Carrum Downs, there's been one case, was vaccinated. 62% of the staff there are fully vaccinated. 82% have at least one vaccine. There's in-reach testing being done there today, and there's a local GP to vaccinate additional residents and staff in coming days. Kassar Suites in Coolaroo, one case notified on the 1st of September, now already 37 cases. Located within a busy shopping strip near T-Bus restaurant and Hassoon Cafe. And then, of course, there's the base backpackers. One staff case from Acquire resides there in St Kilda. All resident staff and visitors are delegated or designated as primary close contacts. The case has been transferred. The partner and several at-risk close contacts are in formal hotel quarantine. There are approximately 70 residents and alternative accommodation is being arranged for them. And then lastly, the Hume Valley School, a special needs school in Dallas, now 5 cases with 2 students, 1 staff member and 3 additional household contacts. Just a reminder for supermarkets in terms of COVID-safe practices. Supermarkets and shops are absolutely essential. Everyone will go there at one point in time. They're not inherently high risk, but they are high volume for our contacts. They have a lot of human movement through there. That means many thousands of Victorians will shop alongside those who are not yet diagnosed with COVID-19. So a reminder that it's 1 member for each household once a day. Think about minimising your exposure, keeping your distance. Don't be caught up in an exposure site. If you can click and collect for your shopping, please do so. Go less frequently. Check in with the COVID-safe QR code. Wear a mask and keep your distance, including when reaching over someone to get something on the shelf. Just take your time to keep that distance. We've worked closely with supermarkets, as have Department of Jobs, precincts and regions. They're extremely cooperative and helpful. They absolutely want the best for their staff, understanding the risk, customers and all Victorians, and I'd like to thank them for all of their cooperation. And really, lastly, a plea to all Victorians of any background that there are supports available. We can help you as you require it. We're continuing to see reluctance to come for testing until it's too late. That's not to place blame, that's to recognise that there are challenges for individuals, there are concerns about coming forward for testing. But by getting tested, because testing doesn't make you positive, getting infected is what makes you positive. Getting tested is what allows you to protect your family, to get early treatment as required, and to make sure that this doesn't spread any further than it needs to. If you're concerned about losing money, support's available. Go to www.coronavirus.vic.gov.au, click Financial Support on the homepage. There's the COVID-19 disaster payment if you can't work because of restrictions in place. There's the $450 test isolation payment if you can't work while you're awaiting your test result. And of course, there's the $1,500 isolation payment if you have to quarantine for a 14-day period as a close contact.